Assalamualaikum students, welcome to my channel. Students, in this video I am going to discuss about the foramen of the skull and the structures passing through these foramen. There are many foramens present in the norma maxillis interior of the skull and the certain structures passing through these foramen. In this video I'll elaborate all the foramens and their location and the structures passing through these foramen. Mostly the cranial nerves are passed through these foramen, which have certain functions. So let's start. Here is the diagram. You can see. Here you can see. Normally we divide the interior of the skull into three parts: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. These three are the fossa present in the interior of the skull: the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. Anterior cranial fossa has the cribriform plate, while the middle cranial fossa has superior orbital fissure, optical canal, foramen rotundum, foramen ovale, foramen lacerum, and foramen spinosum. And moreover, in the posterior cranial fossa there are also the fossas present, foramen present, through which the certain structures pass out. First, in the anterior cranial fossa, here you can see in the anterior cranial fossa there is the cribriform plate through which the first cranial nerve passes out. First cranial nerve is passed by the cribriform plate present in the anterior cranial fossa, and then the superior orbital fissure, which is present at the junction of the anterior cranial fossa and the middle cranial fossa. The superior orbital fissure through which the third, fourth, sixth, and first division of the fifth cranial nerves are passed out. These are the structures that pass through the superior orbital fissure: third, fourth, and sixth cranial nerves, and the first division of the fifth cranial nerve. Fifth cranial nerve has three divisions: first division, second division, and the third division, while the first division of the fifth cranial nerve passes out from the superior orbital fissure. Then the optical canal, which is also present near to the superior orbital fissure. From the optical canal, the second cranial nerve passes out. Then the foramen rotundum. Foramen rotundum is the structures that passes the second division of the fifth cranial nerve. So the fifth cranial nerve has three divisions: first, second, and third divisions. Second division of the fifth cranial nerve is passed out through the foramen rotundum present in the middle cranial fossa. And then the LOS. LOS stands by the foramen lacerum, foramen ovale, and foramen spinosum. These are present near the junction of the middle and the posterior cranial fossa. Foramen spinosum is responsible for the passage of middle meningeal artery. There is no passing out of the nerve. There is the structure that is passed out from the foramen spinosum is the middle meningeal artery. And then the foramen ovale. Foramen ovale is responsible for the passage of the third division of the fifth cranial nerve. So the fifth cranial nerve has three divisions: first, second, and third. First passes from the superior orbital fissure, second from the foramen rotundum, and the third one is from the foramen ovale, which these three divisions are passed out from the foramen present in the middle cranial fossa. And then the foramen lacerum. Foramen lacerum is responsible for the passage of emissary vein, and carotid canal passes through its posterior wall. So the foramen lacerum, emissary vein, and the carotid canal that passes through its superior wall. There are two structures that pass through the foramen lacerum. Next, move toward the posterior cranial fossa. This area is called the posterior cranial fossa. Here are the internal acoustic meatus, jugular foramen, hypoglossal canal, and the foramen magnum. Foramen magnum is a big foramen present in the posterior cranial fossa. Internal acoustic meatus is present at the junction of the middle and the posterior cranial fossa. It is responsible for the passage of the 7th, 8th cranial nerves, labrum thymus. 7th, 8th cranial nerves are passed through the internal cystic meatus. Then the jugular foramen. Jugular foramen is present in the posterior cranial fossa. It is responsible for the passage of 9th, 10th and 11th cranial nerves. Plus the jugular vein is also passed out through the jugular foramen. Next, move to the hypoglossal canal. Hypoglossal canal. 12th cranial nerve is passed out through the hypoglossal canal and the foramen magnum. Here is the, you can see, from foramen magnum, medulla oblongata is passed out with the lower border of the spinal cord. So the medulla oblongata is passed out from the foramen magnum. 12th cranial nerve is passed out from the hypoglossal canal, which is present near to the foramen magnum at the periphery of the foramen magnum. And then the jugular foramen is concerned with the passage of 9th, 10th and 11th cranial nerve and the jugular vein. So this is the posterior cranial fossa. The foramen present in the posterior cranial fossa and the structures passing through these foramens. So all these one are the foramens and the structures passing through these foramens. I hope by watching the full video you have easy concept to memorize these foramen and these structures passing through these foramens. Thank you very much.